construction of a risk model associated with prognosis of post-stroke depression based on magnetic resonance spectroscopy. As a responsible neurologist, we should not only give stroke patients accurate treatment, promote the rehabilitation of neurological functions, but also care about the long-term prognosis of the patients. The post-stroke depression refers to the depression symptoms of post-stroke patients, such as depression, pessimism, unwillingness to participate in social activities, insomnia, anorexia, and feeling guilty or even committing suicide. PSD not only significantly worsens the quality of life, delays the recovery of neurological function and leads to extra medical cost, but also increased the risk of death to 3.5 times within 10 years. The incidence of PSD is mostly concentrated 2 months to 6 months after stroke. So how we know the patient's condition depends on the follow-up after discharge. However, untimely follow-up, poor objectivity, and lack of awareness of the illness by patients and their families may affect the diagnosis of PSD. An objective, accurate prediction of PSD coupled with early intervention during hospitalization may be a promising approach to understand the pathogenesis of PSD and reduce its burden. Proton magnetic resonance spectroscopy is a non-invasive imaging modality that observes metabolic changes in damaged brain regions, and is used in a variety of neurological conditions. In recent years, research on depression and other mental disease, especially the metabolic changes in the brain areas related to PSD, has become a hot topic. This study aimed to use lasso regression to screen relevant indicators to build a PSD risk prediction model to allow for timely intervention for PSD patients at an early stage. Data of 61 patients hospitalized with stroke from November 2017 to March 2019 were retrospectively analyzed. After 61 patients had been admitted to hospital for routine clinical information collection, MRS examinations were performed to measure the ratio of choline to creatine and N-acetylaspartate to creatine in specific brain regions. 2 months after the onset of stroke, these patients were assessed using the Hamilton Depression Scale. Based on the scores, patients were divided into post-stroke depression and post-stroke non-depression groups. 22 characteristics were extracted from demographics and MRS imaging data. The lasso regression was used for optimal feature selection, and the nomogram prediction model was established. In this study, bootstrap method was used for repeated sampling for internal verification in order to better verify the accuracy of the model. We promoted the established risk prediction model to other neurology departments of various hospitals in Liaoning province. The model's predictive ability was validated by a calibration plot and the AUC of the RUC curve. The ADL scores and NIS scores and 3 MRS imaging characteristics, including the ratio of choline to creatine of frontal lobe, temporal lobe, and anterior cingulate cortex, was screened out by lasso regression, and the nomogram model was established by the 5 independent risk factors above. The consistency test between the predicted value and actual value through the calibration plot found that the predicted probability of the nomogram for PSD correlates well with the actual probability. The AUC values for internal and external validation were 0.86 and 0.88 respectively, indicating that the model had a better ability to identify and predict the risk of PSD. Finally, we drew a conclusion that the PSD risk model based on MRS may help guide early treatment of stroke and prevent progression to PSD.